We are so profoundly thankful for receiving funding for these aging suits that we now have, when we feel that most healthcare professionals actually don't have sensitivity to the experience of what it's like to have an illness. And while illness is not due to aging, we know it's common, much more common the longer you live. I find that medical students, nurses, and any healthcare professional better relates to someone in their own stage of life. And many of our students now are growing up with grandparents who are across the world or across the country. And so they really haven't taken into consideration what it's like to have multimorbidity, meaning multiple concurrent illnesses. I often tell students that down the road, likely a nurse will bring their older patient into the office and sit them down, and they will walk in and they will walk out, and then the nurse will help the patient leave. What they're missing then is seeing how the person's able to manage simple things. Walking 20 feet, getting up out of a chair, undressing for a physical exam. This is pivotal, because when someone starts losing these basic activities, it means their independence is at risk. And we need physicians, nurses, and all healthcare professionals to develop empathy. And these suits are a perfect tool to do that.
I think it's helped me realize that it's really important to take the time and really talk to the patient, because, I mean, for me, I was experiencing many different things, and it's going to take some time for me to get all those out, and so I think really taking the time to talk with the patients is important.
Yeah, I think it's important to not focus on the one disease or the one thing that they're presenting with that day, but to take a broader view of the patient as a whole, because even though medically it might not be concerning that their joints are a little sore, it's still something to address to make sure that you're helping them achieve the best quality of life that they could have.